So here we're looking at an arthroscopic view of a left knee medial compartment. The femur is a rounded structure up above, and the tibia is the flatter structure down below. Meniscus is in between, and we start to explore that with our probe. We see that there's a tear towards the posterior aspect of the meniscus, and that tear extends to a portion which is flipped and incarcerated underneath the menisco-capsular junction. We take our probe and we can flip that into the knee joint, and we can see the portions of the torn meniscus that have been causing symptoms. We utilize specialized instrumentation to clip the meniscus and remove the torn portions. There's no vascularity to the meniscus, so it does not have potential to heal in this zone. We can also use an oscillating suction shaver. The suction component draws tissue into the oscillating blades, and this helps to remove the debris and trim the meniscus back to a stable structure that does not cause symptoms and reduces the risk of wear and abrasion long term. Sometimes we'll swap the camera over to the left side and the instrument's coming in from the right. This helps us approach the anterior portion of the meniscus, and we're trimming and smoothing that meniscus back to stable structure. We still see that there's some torn portion on the underside of the meniscus that needs to be addressed in the posterior horn. We bring the arthroscopic biter back in to help finalize some of that posterior horn and junction with the mid-body of the meniscus. And then we'll bring the shaver back in to help clean up debris and finalize the margins of the meniscectomy. Now we can look at our post-meniscectomy view. We see the meniscus is trimmed back to smooth, stable meniscal surface. We can take the knee through a range of motion. We can bring it into extension and flexion, watching the femur roll up on the portion above. A little bit of synovium comes in from the left, but we can see that that meniscus is now traveling smoothly with no impingement or abrasion.